Hi, I'm Darren Bernard. I'm here with Jonathan Warzak, here with the Patient series. Jonathan and I have just had a bit of a discussion about getting back to your sport or activity after a total hip replacement. So I'm going to test him on when he thinks it's the right time to come back.
Good to see you. Good afternoon, sir.
Good to see you.
Test away.
Yeah. My first question, I think we're going to agree on this one. Quality versus quantity. Is it the distance a person walks or the quality of how much of their actual gait pattern?
That's an excellent question. I'm sure we're in complete concord. It's vital that people walk well for a shorter distance than push themselves and start limping and causing damage elsewhere. And I've lost count of times I say to people, you must do what the physios say. Use a cane or a crutch if you need to. Get the habits back. You have to break the bad habits you almost learned before the surgery. If you continue with them, the recovery is way slower.
Yeah, so it's all about the quality.
Quality completely.
So we're agreeing on
100%.
that. One all.
Right. I'm not counting.
Yeah. Walking. When would a person, in your opinion, someone that you've worked on a total hip replacement, have the ability to walk 1 mile? Let's say a 60/70-year-old.
I think if you're someone who's got good heart, good lungs, no reason not to, I'd be pretty happy for them to walk between 4 and 6 weeks afterwards. You need to build up to it slowly, and as we just said, you might need to have a stick to help you walk that mile.
Yeah.
Most people I find sort of take the stick and then gradually use it less and less and less.
Yeah.
And we're constantly saying to people, use it in the other hand. It seems so counterintuitive, etc. But no, I'd be disappointed if I saw someone at 6 weeks who wasn't. I know there's a huge variety of recoveries, but I'd expect a stronger, younger patient to walk a mile within a month.
Yeah, I mean, I love it when at about 6 weeks they'll come and see us and they're swinging the stick. They're actually
it. Precisely. It's a thing to ward off evil spirits rather than actually
just carry it, just to warn people.
Social distance.
Yeah, and then if we progress that from walking 1 mile to walking 4 miles in the woods, what type of time span? Again, a 60-70-year-old that was looking to get back to that. They were doing that before the arthritis really compromised their ability to cover those distances. What would you?
That's a good question. I think perhaps I would give a bigger range on that. I'd say probably between 6 weeks and 3 months or so.
Yes.
There may be some people who don't feel comfortable on off-road or sort of fell walking service for 6 months or more. Yeah. And it's crucial not to fall and damage the new joint. But I would say, really, I give a variable time. 6 weeks to 3 months is reasonable on that.
Yeah, so within that range.
Yeah.
I had a lot of people love their golf.
Yeah.
Give us your thoughts on golf in terms of distance, in terms of number of holes and type of.
I think I'm happy people to go back to sort of putting as soon as they're comfortable, perhaps 6 weeks or so. Okay. Go back to the driving range, 6 to 8 weeks. Short game at that stage too, 9 holes to see.
Yeah.
An idea to have a buggy or a trolley. I wouldn't carry your clubs at that stage.
Yes.
I'm really hoping that somewhere between 2 and 3 months that people can go back to playing 18 holes, etc. But there's no reason you can't go back and do some practice earlier than that.
Yeah. And I'm not letting my patients go back to 3 months, even when my patients say, Jonathan said they could go back at 2 months. I'm just a bit more conservative, but I don't want it coming back to me.
It's all about caring for the patient.
Yeah, that's right. Once we had a patient that loved his road cycling, so these are the guys that can get up to 20, 30, 40 miles over a weekend.
Yeah.
And in terms of someone who wanted to get back on the road and cycle for 5 miles, when and what reasons would you give for when they need to get back to would get back to cycling 5 miles?
Oh, that's an excellent question. I think obviously you've got to be safe mounting and dismounting on the bike as well as riding it. So because of the small risk of dislocation, I would say I probably wouldn't get on a bike other than a static bike.
Yes.
For 6 weeks or so.
Yes.
So after 6 weeks or so, when I'm happy to bend the knee above the hip, bring the knee above the hip.
Past your 90 degrees.
Past your 90 degrees, that should be okay. So I'd say I'm happy with that. Obviously we both know there are risks of road biking, and if you fall heavily for up to 6 months after a hip replacement, your bones are a bit more vulnerable. But that's an individual choice. So somebody who's really keen to cycle, I'd say, get on a static bike as they would with you, work at that, 6 weeks on the road, and just take care.
Yeah, so a good 6 months. You don't want to. It's not so much the cycling, but it's the other drivers. You don't want to get hit at any time, but we don't want to compromise the prosthesis.
Completely agree on that one.
We have a couple of yoga Pilates teachers where I work, and they talk about if we had someone that likes their yoga or Pilates, we tend to say 6 months before they do that. What would be your take on someone that you've replaced their hip? How early or what time span would you allow someone to do yoga?
I think I'd be a lot less prescriptive on that. I don't want people going obviously into extreme lotus positions or dog stretches, etc. Yes. But I think yoga is really important for stretching, for flexibility, and it's a good thing that people can do when they're recovering and they can't walk or run long distances. So I would say I'm happy to go back after a few weeks. I use the old-fashioned simple mechanism, simple measurement. That if you imagine 10 is your worst pain, if you don't exceed 4 out of 10, you're not causing harm on that. I'm happy to go for that.
So that's a good little rule of thumb.
Simple rule of
listening to yourself.
Or if you say an ache is okay, a sharp, intense pain is a warning.
Yes. Loads of people doubles tennis. So not as intense as singles tennis, but you're still doing your lateral movements, your forward, your backwards. You might leave the ground for a split second. What's your take on that in terms of someone coming back to that?
I want to give, particularly there's a degree of impact, degree of jumping on that, degree of lateral movement. You've got two factors here. One is the stability in terms of the muscles. Number two is to make sure the implant is fully healed and bedded onto the bone, which can take 6 weeks or so. So I'd probably say want to wait at least 6 weeks. You might be safer if you're going to be playing quite competitively to wait for 8 weeks.
Yes,
personally.
Now I've never had a client that's done this, but I want to ask you about someone that's had a hip replacement, you could say early 50s, that would like to get back to football. I've never had one. I've had a referee that was changing directions and keeping pace at a very high level. What would be your take on someone that said, look, I want this, because it's about quality of life now, it's not about get rid of my pain, it's about I get rid of my pain, get me back to what I'm doing, maybe not as good as I was, but when could I, if possible, get back to playing competitive football? Men's league, it's not a mad thing, but it is changing, it is hopping, it is jumping, it is twisting, it is getting knocked down. What would you...
I think it's, again, a good question. I think the additional risk factor in that obviously is the contact. There's still the jumping, the running, changing direction, but it's the potential of body contact. So I probably would be a lot less... So I'd be more prescriptive in that and say, I'd really want to, this is where you and your colleagues come in, is someone got the aerobic fitness to do that? They demonstrated their ability to jump and squat and lunge, etc.? I'd say, okay, I'd want to probably be wait more like 6 months on that. I think really that's probably a season or so out on that. Because again, you are way more likely to either have a clash, fall down. I do not want a patient to have a heavy fall onto a fairly new hip. So I'd say I'm very happy for people to train. But I don't think I'd like to have you playing where there's going to be a degree of contact for 6 months to be safe.
And I would agree with that. I think it's one of those things where in a game of football, in a game that's unpredictable, if it was a practice where nobody's touching you because they know you've had this operation, that's fine, you can move, pass the ball, you can be you can challenge yourself but not overdo it. It's still a controlled environment because no one's going to come along and clean you out. Brilliant. I mean that's really helped a lot for myself and
me
my
too. It's
practice.
good to have a discourse. Did we agree on everything or nearly?
I think I won 5-1. 5-1 is City Liverpool yesterday. Hope you learned something. We'll see you in the next series.
Look after yourself. Thank you.